What's up, everybody? How are you today? This is Jim Prusak, physical therapist from the Pain PT, and we're going to talk today about movement is medicine for pain. And this is something, as a physical therapist, that I talk to with pretty much everybody I see with chronic pain, is this theory or this thought of getting moving again, of getting back to being physically active, and that we can do that in the face of pain, even with our symptoms, and that it's not only safe to do that, it's actually beneficial to do that. It's actually therapeutic to get moving, even with pain. So I want to go over today some of the research that's out there, and there's a lot, but we're just going to highlight a couple studies today to show you, in fact, that it's very safe and very good for you to get moving, even with your chronic pain. So one of the questions that was posed to 670 people with this Creaky Joints organization was, have you started exercising more since being diagnosed with arthritis? And the majority of people actually said no, 59%. So people still have this notion that we should rest, we should take it easy with pain. And the only time we need to do that is if we have acute pain, if we have developed an injury or sustained something traumatic to our tissues, then we need to obviously go back at a slow and deliberate pace. But with chronic pain, we can throw all that stuff out the window and we can start moving. So one of the studies I wanted to go over here was a study on knee cartilage. People have osteoarthritis in the knee. And the reason why I chose the knee, it's because it's one of those joints where people think that moving with knee arthritis is bad, or going up and down stairs, or walking, or doing any type of aerobic exercise or fitness is bad for your knees. But in reality, the studies show that's not true. This was a systematic review of randomized controlled trials, and the conclusion was that knee joint loading exercise seems to not be harmful for articular cartilage in people at increased risk of or with knee osteoarthritis. So it's actually, the evidence is showing that we're not damaging our knees by engaging in exercise and getting active again. It's just not true. This study looked at the effectiveness of walking versus other exercise on pain in people with chronic low back pain. This is also a systematic review which takes a look at multiple trials, and that's why they're very good to look at these systematic reviews, because they pull the data from many, many trials. And so their conclusion was that they found that pain, disability, quality of life, and fear avoidance similarly improved by walking or exercise in chronic low back pain. Walking may be considered as an alternative to other physical activity. Now, this brings up a good point in that it doesn't really matter what type of exercise you engage in. You want to do something that you enjoy. And the studies show that it doesn't really matter. And when it comes to low back pain in this case, there isn't not one particular exercise that's superior to another in the science, at least, for reducing pain or for not damaging yourself. It's all the same. So you just want to get moving. You want to get active is the message here. Now, this is really interesting. This study came out this year, 2019, and it's really cool because most people think, okay, I should go exercise. I should, engage in some exercise. But if I do too much, that's going to be bad for my body. It's going to hurt my joints. And we have this thought or notion that, like, long-distance runners and marathon running can really damage our knees. And so this was the study that looked at that. And the answer is that no. And in fact, what they found was that the people who were doing marathons actually improved their joint health on MRI scans. Their actual MRI scans improved with marathon training and running a marathon. So it's actually the opposite of what we think. And what was quite interesting from the study as well was that they took these MRIs before the people started training, and then they took them after the marathon. And they found that basically in all the 82 subjects that pretty much all of them had some type of what they would consider damage in the knees on MRIs, but they had no symptoms. So that kind of falls back to what we've been talking about here with all these videos, is that structural changes are not related to pain most of the time. So that was really interesting. That wasn't one of their purposes of the study, but I found that interesting, is what they found from the beginning of the study and the end of the study, that there wasn't really a correlation with pain. So here's the last thing we're going to talk about. Should the exercise we're doing be painful in the management of chronic musculoskeletal pain? This again was another systematic review and analysis of many studies. And what was interesting here is that they found that exercise protocols using painful exercises, meaning people had pain during the exercise, actually offered a small but significant benefit over pain-free exercises in the short term. So this is really, really interesting to note and important to note, because a lot of people like yourselves are going to shy away from wanting to get started with exercise because you might hurt or you have pain. But the science shows that actually getting moving in the face of pain actually offers you a better benefit than going so slowly and with really small graded movements that don't create pain at all. The science doesn't support that. And the medium, the long term, there really isn't any difference between exercises with pain or exercises with no pain. But in the short term, there is. And so that's important. That's the time period where we're just getting started moving. We're just getting going again and getting active. Most of the time we're going to have pain. We're going to have some symptoms. But the important thing is that we don't stop. We continue the move. We continue the exercise. So that's what they said. They said basically that pain during therapeutic exercise for chronic musculoskeletal pain need not be a barrier to successful outcomes. So it need not stop us from exercising. And that's the point of this here, is that we actually need to get moving in the face of pain. We need to actually start to work through pain and work with it and realize that we're not damaging anything further by getting going. In fact, we're probably helping our tissues. We're helping ourselves even in the face of pain. We've got to get this notion out of our heads and out of our minds that we need to rest. We need to take it easy. So I challenge all you to get going, to get moving in whatever capacity you like, whatever you want to do, whatever your passions are, your hobbies are. Just get going, get moving, start an exercise program. I think you'll find that if you keep on it, you'll find massive benefits over a period of time. All right, everybody, have a great rest of your day, and we will talk to you soon. Bye-bye.